This is BMI Redefined with Jen and Mo.
All right. Welcome to BMI Redefined with Jen and
Mo.
And we are here today with an amazing guest, and we just want to talk for a few seconds to say what we're doing here at BMI Redefined. We're looking at perspectives and perceptions within ourselves and within the world around us. And each segment will have a guest and a story. And today, Mo's going to introduce our famous guest.
Our famous guest today is my life partner, my best friend, and my husband, Dr. Andrew J. Bierhals. He is from Wash U, and Andrew and I call him Andy. Everybody calls him Andy, so we're just going to stick with Andy. Is that okay, Andy?
Yep.
Great. Awesome. So you've just met Andy. Andy is...
Hi, everyone.
Yay, hello. So Andy is not just my husband, but he's also a great dad to two kiddos who are actually here today because of COVID-19. We are doing school inside the home. So one is on Google Hangouts, the other is on Zoom, and afterwards we are going to be walking the dogs, trying to get some exercise, and we'll do some cooking. I think Andy didn't, 2 days ago, we both taught Sebastian how to grill, right?
Yes, we did.
Salmon. So that was pretty fun. Good answer. And it was, and so we're trying to just teach everybody, little things here and there, life skills. We're trying to take advantage of the time we have with them because believe it or not, in a couple of years, they're going to be gone. So today I get to introduce to you Andy Bierhals, who is MD, MPH, and he is Director of Cardio-Thoracic Imaging at Barnes-Jewish West County. He is also Vice Chair of Quality and Safety at Barnes, and he is an Assistant Professor of Radiology. And he is my guy, so I'm so glad he's here today to talk to us about COVID-19 in the hospitals and whatever else he wants to talk about. So, Andy, I would like to ask you a few questions as well as Jen, if you would be so inclined.
Yes.
Oh, good. Okay, Jen, do you want to go ahead and ask Andy a question?
Yeah, I kind of just wondering, Andy, and I'm sure the listeners are too, is like, what is your typical day like, okay, in the hospital working around COVID-19 right now, kind of pre-pandemic and currently, and how has it changed?
So in radiology, things have changed a little bit for us, probably. So prior to COVID, prior to the pandemic, our typical day would be, you would be in the hospital in patient care areas, reading or interpreting imaging studies fairly closely with the patients, fairly integrated with patient care. Since the pandemic has hit, as most radiology programs around the country, we're practicing social distancing, much like everybody else, to keep staff healthy as well as patients healthy. So we have actually expanded where we're interpreting studies from. We've opened up areas to interpret studies outside of more patient care areas in different buildings, as well as the ability to interpret studies from home. So we've been practicing kind of extreme social distancing. So that's really been the big change for us. That's in everyone's, best interest, both staff and patients, to minimize foot traffic in the hospital.
Oh, that's good. That's good.
Mm-hmm.
All right, Mo, you have something?
So currently with COVID-19 pandemic augmenting lives globally, in what ways are you working, your team working on processes, new processes to protect and enable healthcare continuity?
Okay, so again, with the pandemic that hit, as with all of the various both WHO and CDC guidelines, there was an initial push to kind of shut everything down, for lack of a better way of putting it, to really focus on the coming surge to help direct care towards patients who might be presenting to the hospital for COVID. Again, limiting elective types of medical procedures, one for social distancing to get healthy people out of the hospital so they don't get exposed, but two, also to have enough resources to deal with any surge or with any additional patients that might have COVID. As time is going on, and probably people have seen now in the media, there is a greater push, desire, and necessity to start expanding and opening up things again, because patients, again, you can defer care for some time, but there's a point at which even routine care now is going to have to be reintroduced back into the system. So right now, that's where a lot of the efforts are going. Again, keeping people safe on now, but also thinking about and developing workflows to allow non-COVID related medical care to go on, to allow patients to come back into the hospital systems in a safe fashion.
Okay. Okay. Do you think that we will be, I mean, I don't know if this is really a question to ask, but do you think that we will be opening sooner than later to get patients in? Because what I want to know is what are happening to the patients who are having just like regular heart attacks or strokes, or who are ill? Where are they going?
So
What's
regular acute care hasn't changed. Again, patients that have cancer or acute problems like strokes or heart attacks, that care is still going on in the hospital. That hasn't stopped. It's, some more routine care that has kind of ramped down. And I would argue that, or say that probably in the next, months coming up, there will be reintroduction in phased fashions that are safe to allow patients that are seeing or needing more routine care, whether it be, say elective types of procedures such as hip replacements or screening colonoscopies over the next couple of months in a staged, controlled fashion to allow them to return back to the medical establishment and to have their routine care. But again, it's going to be done at a very larger level, whether it's state or national, and it's going to be done in such a fashion to make sure that everyone is safe in the healthcare system and they don't get infected with COVID, and we still maintain social distancing.
Okay, cool.
Okay.
Jen?
Yeah, so just thinking, we're in our, 6th week now of the social distancing, quarantining, and don't have the same tank of gas that I've had in my car for the last 6 weeks, not going
See, look, there's an upside. You're using less gas.
Exactly. I'm saving gas money, Andy.
The price of oil has dropped to what, nothing? So we're all good.
Yeah.
Right, exactly.
So just thinking about that, us being here in the St. Louis area, would you say, when we started this push in Missouri and in St. Louis area for social distancing, we kind of jumped on that bandwagon to flatten the curve, to keep it from spiking as high as it was headed. Do you think we jumped soon enough? So social distancing, do you think that we should have had it happen sooner, just from the cases and numbers of cases that us outside the hospital world are hearing about? From inside the hospital, what do you think? Should we have tried all this sooner, or are we on track?
I mean, given the data and the information that everyone had, I think things were, people acted appropriately in the situation. The curve, we haven't seen a big hit of cases in St. Louis area and Missouri in general. While there are cases, we've been able to really keep them down, that there was no big rush or surge at the hospital, again, allowing for safe care. So I think, again, it's a balancing act that, yes, you could always argue, could you have done it sooner, that maybe there would be fewer number of cases. That is true, but it's balanced against when you shut everything down. Again, routine care has gone away, patients having access to care, things are a little bit more difficult. So I think, we've acted prudently. I think people, that because of how everything has been acted, people have acted, the number of cases has been kept down, the curve has been flattened in the St. Louis area. So that's a good thing.
Yeah, that's what we're hearing.
Yeah. And yeah, because, I was afraid that we would become like, my home state, like another Detroit or, something like that.
Your home state of Detroit?
My home state of Michigan, Detroit, Michigan, whatever. Oh my gosh. See what I have to deal with?
I love you guys. So I was just thinking, so we're talking inside the hospital. So one thing I was curious about, Mo and I were talking about yesterday, is has there been, I mean, as far as staff and professionals coming in to work in these different areas for the cases of the heart attacks and the acute care and everything you're talking about, has there been kind of a cross-disciplinary
Shift.
work, shift between professionals, like somebody was in the ER, now they're in the ICU, or vice versa, or what have you seen?
In St. Louis, there hasn't been, again, the surge that people have been pulled out of their specialty, let's say radiology, to help care for patients in ICUs or on the floors. We've been lucky enough with that. But, healthcare, especially in St. Louis, we've been very collaborative. The healthcare systems, have worked very well together to, coordinate care and to really kind of keep the cases down and help, really work in the best interest of the patients.
Mm-hmm. That's good. That's good.
And what do you feel that, the expectations are now going from, we're here now, what do you see in the future of medicine moving forward? Do you think that there will be a change of how people operate?
I
Not
think
operate, but
I think definitely in the foreseeable future, there is going to be the work is going to be definitely different. There's going to be a greater focus on social distancing, on making sure that patients are safe as they're flowing through the healthcare system, keeping staff and doctors and nurses and technical staff safe. So I think there will be a change, as that goes on. Whether or not we get back to where we were before, that's going to be a different discussion, where we're going to end up.
Okay.
Well, I was along that same line with with telehealth and all that going on. We talked to a psychologist the other day about how she was working with clients on that avenue. And so will there be more prescriptions approved, or some more from a phone call standpoint, and less visiting the actual office? I mean, what do you think? Are we going to continue that vein?
I think there probably will be. This is a good, force, or we were forced to go with telehealth, and I think that probably will become a little bit more routine for maybe routine follow-up visits and minor problems. That there will be the shift to telehealth. I think it helps everybody. One, it's more convenient. Two, again, there's some social distancing aspects of it. So and as people have more access to computers and things like Skype and Zoom and other products equivalent, really, that's going to become, I think, more of a cornerstone of routine care.
Mm-hmm. And didn't it used to be like that at some point? And then
you're talking about the doctors coming to your house? Yeah, in the 30s,
house
40s,
calls
and 50s. Yes.
Yeah.
So it's a new version of a house call.
Right. Okay.
Right. Yeah.
Which I'm all for. That's fine. But I have my own house call right there. But that's okay.
You do.
I drive him nuts, but that's okay.
You already got that handled, Mo.
Notice how he's not saying anything?
I'm just going to stick out of this one.
Smart.
Yes.
Oh.
So what do you see as the main challenges? So we've talked all around this and through it, as far as what's going on, what the manner and the methods were pre-pandemic, what's going on now, some of the expectations for the future. But what do you think will be some of the biggest challenges to just get back in the middle of the road, back whatever the new normal is going to be?
Well, I think that's the big challenge is how do we turn things back on, whether it's healthcare or the economy or society in general, in a safe manner that allows people to get out and live a normal life. Whether it's a new normal, whether how we do things is different, that's we're gonna see where that takes us. But I think that's the big challenge moving forward, is how do you, in a staged, safe, controlled way, get us back to a non-quarantined or non-stay-at-home order structure.
Mm-hmm.
Yeah. And just thinking, not to ask you to be a predictor or fortune teller or forecaster, but I mean, do you think we're still going to be seeing people walking around in masks in 2021?
I don't know the answer to that. I would say you'll probably see, it'll be more common to see random or to see people in masks. Whether it will be everyone or a large proportion, I don't know, but I'd say it would not be uncommon to see a few more people than we did before.
Mm-hmm. Yeah.
Yep, exactly. Okay, well, what do you think, Jen?
It's been some great conversation, Andy. Thank you so much.
Thank you.
Thank you so much for joining us today. And even though you're just like right upstairs and I'm downstairs, but that's okay. Or excuse me, you're in Austria. Is that where you're at? I'm guessing.
Actually, no, that's in Bavaria.
Oh, Bavaria. Okay. Excuse me, because they're so different. Well, they are different, actually. Very different.
So, Andy, is there just kind of a final comment, final note you'd like to leave with our listeners before we?
I mean, a final comment, again, over the next, we're going to have some challenges over the next, months. For how long, I don't know. But, again, society will start to reopen. And I would say, look at that as a positive and understand that, when things get opened in a staged fashion, everyone's trying to do that as safely as possible to, again, to protect everybody.
Yep. All right.
Right.
Thank you so much for your insights, Andy.
Thank you, Andy. Okay. Thank you, everybody. Joining us today. Bye. Okay. Should we sign off, Jen?
I think so.
Okay. Let's
Wait,
go.
you have your coffee, right?
I snuck out today. I did wear a mask.
You asked for that.
I did. 11:03 a.m. Oh, okay. It's 11:03 a.m. according to my. It just seems like this is just so much at sometimes. And it's, it just seems like it's a lot. Yeah. But, as our guest Andy said, this is not going to be forever. It's going to be a slow turn on.
Yeah.
But it's just been a lot for our society, a lot more than I think what we thought it would be.
Well, and it's just thinking about what came to mind when you said the slow turn on is when you and I are both researchers, in our degrees and our work. Mm-hmm. And think about when you're doing a study, how you only turn one dial at a time to see which variable is acting. Right. To see what your hypothesis is telling yourself and telling the others. And so, that's kind of what I think we're going to be doing here is kind of turning one dial at a time and how we reopen the economy and get back into the healthcare and back into the retail and back into the restaurants and the small businesses and all that it's going to be, like you say, and like Andy said, it's going to be a slow turn on.
It is. And just to figure out, what works and what doesn't work.
That's right. Yeah, if we turn one dial, we might have to turn it back off.
Yeah, exactly. Okay, well, this was a little, kind of funny. But anyway, okay, I'll talk to you later. I'm going to go have my coffee.
Have your coffee. All right.
Yummy.
This has been BMI Redefined with Jen and
Mo.
All right.
Bye. Thank you, listeners. Bye, guys. Bye.